Lily is an active 5-year-old girl. She's content and curious, so the thought of sitting quietly in a waiting room is not part of her plan.
Hi, we're here for blood draw for Lily. Going to the lab has been a challenge. Often she'll be, running around the waiting room, bumping into people, trying to take things out of their hands sometimes. It's all things that I'm used to and I'm used to managing, but for others who have no experience with children with autism, it seems a little bit awkward or scary. Look at this one.
When it comes to medical appointments, her family strategizes to make it as efficient as possible. As for blood draws, faced with a needle, like most kids, Lily isn't a fan.
So some of the things that are
So LifeLabs worked with Pacific Autism Family Network to come up with a way to make the experience better.
with the bubbles are something that the individuals on the spectrum find quite calming, and we have those turned on during the procedure.
There's also a ceiling projector, a DVD to watch a favorite movie, and a massage chair.
So there's an opportunity for the patient to be very relaxed during the procedure, whether they're sitting in the chair or if they're sitting on mom's lap as well. Who wouldn't like that?
This lab at the network is the first of its kind and the only one in Canada. But LifeLabs is making sure all of its 355 centers across the country are able to accommodate those with autism spectrum disorder.
Hey, how are you? Good.
To do that, they're incorporating a meet and greet where concerns are discussed as well as ways to make the visit as positive as possible. They're also arming staff with storyboards outlining what will happen, and they're allowed to use their imagination.
One of the patients that we had come in, we learned from the family that she was really interested in Disney princesses. So before she came into our location for her phlebotomy, we decorated the phlebotomy room with pictures of Disney princesses.
Pacific Autism Family Network, how may I help you?
Joshua is on the autism spectrum. He works at the Pacific Autism Family Network in Richmond. He remembers the stress of getting blood work done when he was a child.
When I was younger, it was very unpleasant. Kind of daunting, a bit confusing.
The opening of this dedicated lab at the network is life-changing for so many, making healthcare and resources accessible to all and reducing stress for families.
This summer we ran a summer camp here in the building, and a little guy came in for blood work in the morning and then went to summer camp. And so to be in a space that was comfortable for him, that he was already kind of accessing and having fun in during camp, and then able to step away for a minute and do his blood work and come back was huge for that family.
For Lily and her mom, Aggie, it's worth driving from Maple Ridge to Richmond to access the services at the Pacific Autism Family Network. It helps take the edge off a situation that can be highly emotional.
Can you look up and see the sky?
It will make it easier for a lot of children to come here. I think coming here is going to save me time in the end. Yeah, time and energy and stress, and for myself and Lily as well. Here, Mommy's gonna roll up the sleep, okay?